South Africa is officially in the fourth wave, and that's according to the Deputy Health Minister, Sibongiseni Idlomo.
Well, COVID-19 cases have been increasing rapidly. This is in the past week, driven by the more transmissible Omicron variant.
Definitely we are. When you look at the positivity rate of COVID-19 2 weeks ago, we're sitting at 1%. Right now, the report was that we are seeing over 25% positivity rate. Therefore, that actually indicates to you that we are definitely on the fourth wave. The numbers have actually gone up very fast, more in the province of Gauteng than the rest of the country. But safely to say, all of us should be at an alert. The country has moved into the fourth wave.
Now, COVID-19 infections have skyrocketed once again. 16,055 new cases have been recorded in the last 24 hours. Gauteng is the epicenter, leading with 11,553 new infections, and that's followed by the Western Cape with 957 new cases. KwaZulu-Natal has 897 new cases, and the Northwest recorded 805 infections. Mpumalanga recorded just over 600 new cases, and Limpopo has 500 cases at the moment. The positivity rate has increased to 24.3%, and sadly, 25 people have died due to COVID-19 related complications, and that takes the overall death toll to 89,944.
Well, it's too early to tell how severe the Omicron variant will be. The variant is said to be driving the spike in infections, taking us into the fourth wave. Deputy Health Minister says vaccines are more like a sword than a shield.
This variant, it's a virus, a COVID-19 virus, that is trying to survive, trying to change its structure and form so that it can escape some of the medication, some of the things that we are doing to it. So part of this Omicron variant has got some remnants of the mother virus, or the father or sister virus that we have been dealing with. And therefore, while there is what the scientists are telling us, still to rely on them, our vaccines, there may as well be instances where it is actually escaping the immunity. It's still too early to tell how severe Omicron variant is going to be. That's why they are watching it. But in all these measures, ma'am, we are still saying, please, let's vaccinate, because we now know, and we're getting the figures this morning, even amongst those who are actually admitted, 2% of them are the patients who have already been vaccinated, and the other whooping 98% are people who have not yet been vaccinated. If you are vaccinated, yes, you may still get COVID, you may still get a new variant tomorrow or even next year, but it will not be as severe as it would be to you as if you are not vaccinated, because it is actually still having some remnants of the previous virus or other variants.
Now, increased testing can't be blamed for the spike in COVID-19 infections, and that's according to Ridwan Suleiman from the CSIR.
Unfortunately, what we are seeing is a very rapid rise in the number of confirmed cases. And while there is an argument that case numbers are not as important as other indicators such as hospitalizations and deaths, it does remain a leading indicator and possibly a glimpse into what we can expect into hospitalization numbers, which we can touch on. But also many people who are infected can possibly struggle with long COVID symptoms. So nationally, the 7-day average is just a touch under 7,000 new cases per day on average over the past week, or that's a case incidence of just over 12 per day per 100,000 people in the country. So breaching a threshold that indicates that South Africa is well into the fourth wave now. Importantly, to also consider is that test positivity rate. We just over 24% test positivity rate, and yesterday also over 20%, certainly is confirming that the number of confirmed cases that we are seeing is not an artifact of increased testing. In fact, had we been able to test more, those numbers would actually be higher.